Okay, so if you could send me, oh, you sent me it already. Okay, with Stephanie and crazy hair. So the question, Stephanie, was, and I'm so happy you asked this. I think this was my friend from Pennsylvania, I think. And she said that her doctor has never suggested a diet change. And what I say to that, and I'd love to hear what you have to say to that, is why would they? Why would your doctor want you to change your diet? Why would someone feed you the information that they know that you can use to heal yourself and no longer need to come them and allow them to receive a paycheck? No one's going to give you the information you need to overturn them. No one's going to give you the information you need to kick them out of their job. So when you're dealing with people who are supposed to be taking care of you, healing you, providing you options to better your health and wellness, just think about that. I think that I shared a while back about I don't know if this was a theory or if this was something actually practiced in China, but the theory was, imagine if doctors were paid to get you better. Imagine if you saw a doctor and by the time 2 to 3 months passes, you're healed or you feel better, you have no symptoms, and then they get paid. Imagine the different outlook that there would be. So when we're seeing these medical doctors that are paying, that are prescribing these medications that sometimes they even get kickbacks from, and not saying that the doctor doesn't want you to get better, because there are some really great doctors out there that do. However, I believe that you are your own best advocate. As Stephanie mentioned at the beginning of when she got on, is we have to be in control of our own health. And you can use your doctors for your lab work and the things that you need, and definitely for medication if you need them. But you have to remember, they're not going to suggest the things that may necessarily completely get you better. And I don't know, what are your thoughts on that?
100%. It's something I mentioned to you clients before. Doctors actually don't spend that much time with learning, training, and nutrition in medical school. I want to say out of the whole 4 years that they're in, and then, they got their residency and all that, they only spend about 25 hours. 25 hours of nutrition. So, as to nutrition, unless they are, maybe a functional medicine, integrative physician, that kind of dabbles in holistic health and things like that, most medical doctors, in regard to specialty, they do not spend that training on it, because they are actually taught to treat the symptom and not the cause. Because just like you said, we are given the tools to take these medications that actually have side effects in other parts of our body, which lead us to have to take other medications to combat those side effects, and it becomes like a snowball effect, right? So why would they arm us with the tools to heal us, to make us not dependent on them? Because the true definition, a healer by definition, is somebody who's going to help you become closer to your whole self, okay? Rid your body of whatever ailment it is, and give you the tools to do so, so you do not have to be dependent on coming back to them. And something I tell my clients, and even consultations, I say that my job is to teach you, to educate you, and arm you with the tools to get yourself better, but to the point that you don't no longer need my services.
Yes, we are so on the same page with that. I love that you shared that, because that is so important. I love that you shared that. And I feel like people like you, myself, and Dr. Blied, we have a passion to see people actually thrive in their health, especially being that we have lupus ourselves. There's it hits different, when we see someone go through what we know, what that's like. So she also shared that, that's scary, that, to know that about some doctors, because how do you know that you're doing things right? How do you know that I'm going to my doctor, I'm seeing them, And in the back of my head, I know that they're probably not going to give me the best advice. How do you know that you're doing things right?
You go through your gut. You literally rely on your gut, intuition. It's something. You know, I'm a very spiritual person, and I really wholeheartedly believe that our gut holds the key to a lot of discernment and things that, you know, will protect us. And there's that feeling. You get it. You get it. Don't ignore it. Don't ignore it. Because I've had great rheumatologists. I've had great in the past.
Yeah.
One, I'll never. My levels were through the roof a few years back, and it was not long after I went off medication. And an allergist actually caught it for something else. So I went to the rheumatologist for a follow-up. She did blood work. And when I went back for the follow-up about a week later, she said, you know, I don't know what happened, but whatever you're doing, keep doing it. You know, and just kind of just said, do it. Just keep going. She didn't try to stop me and say, you shouldn't be doing this. You shouldn't be taking that. Just whatever you're doing it.
Yeah. See, and that's the thing. I think that you, like my friend Andrea, she mentioned you got to do your own research as well, and see how you feel. And what I've noticed too is that you can't just automatically assume that your doctor knows everything. These doctors are seeing, you know, between 10 to 30 patients a day, every 15 minutes, and they become in this routine. They take this routine on, and it's just like, oh, you have lupus, you have this symptom, you have this, you have that. Take this, take that, because this is what I prescribe to everyone else. Prednisone, Plaquenil, and, you know, these pain pills, and then these, you know, anxiety pills, because you're going to have this issue from prednisone and that issue from Plaquenil and this issue from these pain pills. So here's all the other things. And that's just the list of what they're used to prescribing. So some of those things may not work for you. And if you can implement healthy daily lifestyle changes that doesn't even get you to that point of needing any of those, don't we want to seek those out first? Yes, it takes time and consistency and discipline. You know, you got to have discipline, but, you know, the choice is yours. Which road do you want to go on? And so my friend Regina would like to know your thoughts on cannabis.
Oh, listen, do it. I mean,
yeah, I think most holistic nutritionists or people that are about the, you know, plant-based life are gonna be okay with cannabis. I mean, it has everything to do with your endocannabinoid system and your receptors and how it attaches and balances and rewires things. So I mean, to me, you guys know how much I talk about cannabis, and not that I smoke it or get high or anything like that. It's just there are so many uses for that plant in a smoothie, rubbing it on you in your hair, geez, in the bath, just bathing it, soaking it, like, you know, there's tons of great uses for cannabis. So yeah, I'm pretty sure, like she mentioned.
Yeah, that's the newest thing. Oh, they make CBD oils? What?
Give it to me. So if you guys have any further questions for Stephanie, I have pinned her Instagram page. I'm wanting you guys to follow her, check out her recipes, and, you know, ask her questions. She's super sweet, super helpful. And I just know that she has the same passion as I do to see you guys thrive and live a healthy, happy life and implement wellness as a priority. And, you know, I think, you know, that we can, you know, really do well by researching and learning about different things other than what just the doctors say. So if you guys have any more questions, I want to, you know, give Dr. Blied an opportunity to share as well. And she has a lot of great information. So if you have any more questions, you can please feel free to DM them to me or her, and either or I'll make sure that we publicize the question so that way, if anybody else has the same question, they can ask. But Stephanie, if there's anything else that you'd like to share before you leave, anything at all.
One more thing. I'm actually doing free discovery calls, and usually I do consultations first. But if any of you would like just more information or kind of just to see if you want to work with a holistic nutritionist like myself to see if it's a good fit for you, I do have appointments for free discovery calls. If you go to my page and click on the book now, it comes up, book an appointment, and we will try to make it work and, kind of give it a test run and see if, okay, should I embark on this journey with a holistic nutritionist or kind of just, keep doing my thing, so that option is there. If you're not ready to just outright book a consultation, have discovery call options. So just throwing it out there.
Awesome. That's so cool. I might have to do a discovery call myself. No, but thank you again, Stephanie. I really appreciate it. You were awesome. I know people still have tons of questions and there's so much to learn. You guys just remember that your gut is everything. So what you put in it is going to affect your entire body. That includes your skin, hair, nails. And so once we can implement changes that can help us, eat not less toxic food and start implementing, removing toxins from our home and things like that, I think that we'll start to see changes slowly, gradually, and with consistency. You will, though. So please make sure you follow her, get that free discovery call, and stay tuned because I'm going to tell Stephanie bye and we're going to tell Dr. Blied hello. So thanks, Stephanie.
You guys be well.
Okay, so that was awesome. My hair is already coming to afro, but whatever. I told you I wanted to try to look halfway decent for you guys. But if Dr. Blied is here, if you could send me a live request, I'll bring you on. And thank you at home with the Mitchells for all of your help throughout the call and posting what we were saying. Make sure you guys follow Stephanie. And now we're going to bring on Dr. Blied. So Dr. Blied is a licensed clinical psychologist, and she has her own wellness center called Faces of Health and Wellness in Claremont. So she's actually really local. And she, if you guys are not following her already, is doing a giveaway. So she'll also be doing a live coaching session for those of you that follow her page and commented the state that you live in on her last post. So here is Dr. Blied. Oh, look at your beautiful background.
I'm in my backyard, and it's funny. My husband was listening to it too, and he was just like, "Oh my gosh, Stephanie has so many good tips." He was like, "Good luck following that up."
I know. It's a lot, but I mean, I think with time, and as you know, over time, things just take, time and balance. Again, like you said, like some things that might work for some of us might not. Like I told her, I don't think I could ever become completely vegan. I just don't think I could, Right. But I see you got your hair in a ponytail.
Girl, I did my best. So guys, we text each other this morning. We were like in process. And so I have a multi-step process. Yours actually looks better. I was like, oh my gosh, I have 15 minutes. So yeah, this was actually a lot of effort, believe it or not.
And you look beautiful. So thank you for joining us today. And I am really happy that we got to do both of you guys on this call, because I think a lot of times people think that there's one or two or maybe even three things that they can do and that they're going to feel, 100% better, not have lupus anymore, not have symptoms anymore, not have problems in life anymore. But I think that, we all have to realize is that life is a constant journey of pandemics or issues or things or problems. And it's just about dealing with the situation and how you deal with the situation. And, sometimes we are not prepared. It's best if we are. And that is the reason for this immune health and lupus call, is that I think that people need to understand the importance of your immune system, the importance of immune health, the importance of not just toxins in the home and what we're putting in our guts, but toxins of the mind toxins of the spirit, toxins from people, that are in your life that you deal with. Yes. And also understanding that sometimes a lot of the issues that we have, it be anxiety, depression, something I learned from you recently, may not necessarily have anything to do with who you are, how you are, how you handle things. Sometimes it may be an imbalance of supplements or nutrients or something that, you may be missing in your system. So I am so happy that you're here because you bring the element of the mind and the spirit. And that is, as in my opinion, as equally as important as, what we're actually eating and putting into and on our body. So, I am going to leave it open to you to discuss the things of, what you deal with on a regular basis, but, mainly psychological stress. And like I mentioned, treatment of the mind and body. I know we spoke about box breathing and then the importance of sleep, meditation. I know you do a chair yoga on your page, and that was even helpful for me. I was having a little bit of pains in my wrist, and you had us do some wrist and finger exercises. And I noticed almost within minutes after that was done that I felt relief and a little bit more mobility in my fingers and wrists. So please, Dr. Blied, take it away. And sorry we took so long to get with you. But thank you.
It was really important information. So I'll just introduce myself a little bit. Thank you so much for having me on today. So I really can't see comments really well because I wear glasses, but they look like sunglasses, so I took them. So you have to read them so if you need me any questions.
I will.
So I'll share a little bit about my story and how I got to where I am now. So I was diagnosed with lupus in 2012, and this was my second year of grad school. And so around that time, I had a lot of fatigue, really severe fatigue and pain. And I just thought it was because at that time I was a single mom and I was in grad school. So that's just enough stress. So I'm tired and in pain because of stress. Right. But I started to think because it was pretty severe where I would be so exhausted and I would eat something and then I would feel better. But then there was this cusp or breaking point where I would eat too much or the wrong thing and then I'd fall asleep for 4 hours. And so I was thinking that maybe I was diabetic because my grandfather had diabetes. And so I went and got a physical. And I'm just really fortunate that I had some really smart doctors that were paying attention at that time. And so the doctor that I went to said, noticed that I had a positive ANA, noticed that my white blood cell count, the normal is between 4 and 11. Mine was at 0. Or 0.1. And so he was like, looks like there's something autoimmune going on for you. I'm going to refer you to this rheumatologist. Went to the rheumatologist. The rheumatologist was like, I think you have lupus. And I was like, devil, you is alive. And I fired him. I didn't go back and, and I posted this on your page yesterday. A few months later, I went to someone had never met me before and had a physical. And she looked at my lab work and she was just like, do you have lupus? And I was like,
well, actually, I guess so.
I was like, no, oh my gosh, it's just that confirmation or whatever. And I knew I wasn't feeling good. So I took some time to kind of process that. And in the beginning, I had a lot of anxiety about okay, well, what if, and then fill in the blank. And then also a lot of depression. And the rates of depression with lupus are very high. It's a very high co-occurrence, 60 or more percent. I was trying to deal with that while trying to also go to grad school and raise my daughter, and all those things. And I found that now that I'm, licensed, graduated, all that what was most meaningful for me in this time of my life is sharing with people the experiences that I had finally coming to remission and also bringing in a whole health approach to my therapy practice. So in addition to, traditional therapy that I spent years at school, learning, I also bring in, like you mentioned, chair yoga and mindfulness meditation and biofeedback interventions, which is electrophysiological, like monitoring. You hook up like a piece of equipment to your body and it tells you what's going on inside of your body, so that with your nervous system, so that you can be able to recognize it, manage that, and then next time that you're under stress, bounce back faster.
Okay, so these are things like the biofeedback is what you offer at your office, right?
Right.
Okay.
Right.
So now, what are when it comes to psychological stress caused by like things like, or how about, since we're in this whole COVID-19 thing, like, with anxiety, I know for me that when I was the first 1 to 2 years of my diagnosis, I had so much anxiety, so much that I drove my own self insane. I drove myself to no sleep. I drove myself to start thinking and believing crazy things. I drove myself to depression, all of which I think played a huge role into me being in the hospital and almost dying. I lost my appetite. I ended up being on extremely high dosages of prednisone because there were so many issues with me having, when you're so young and you're diagnosed with an illness, or when you're living in a world where there's this huge pandemic, the first thing you do, obviously what we see from our own example, is you panic. You panic, you go into denial, you start looking up theories, and then you become this conspiracy theorist, and then you're just like, this is the real thing, this is the wrong thing. I honestly believed in my heart and soul that I was going to transfer lupus to my daughter. So I started overly cleaning her room, her clothes, figuring out ways that I could keep her a certain distance and not transfer lupus. My brain just literally took me to the worst, and that literally ate me. Yes, and it literally ate me from the inside out. I started doing harm, not harming myself, but that anxiety and depression started doing harm to me physically, and it was to a point where I was unable to function. I was no longer able to sleep, and I think that addressing the physiological stresses of being diagnosed with an illness, and then the anxiety and problems that we get from the medication, I think that's somewhat different because we may not necessarily have control over that. We may, I don't know. But I think anxiety is a huge one. So, me being my first 1 to 2 years of being diagnosed with lupus, and I come to you all crazy and like, what do I do? I'm going to die. I know everybody's going to die. My daughter's going to get lupus. She's going to die. Like, help me. What do you do or say to a person that's in that state?
Yeah, so I have like a three-pronged thought management strategy. I'm going to share that, but I also wanted to share, kind of tying in to what Stephanie, the holistic healer, shared before about your gut health. Your gut health is so important for inflammation because inflammation is actually tied to depression and tied to anxiety. But one of the other things that it's related to is our brain health and our mental health. So 95% of our serotonin, which is a neurochemical, sorry, I'm like shifting my legs. A neurochemical that our brain makes is sourced in the gut. So there's actually more information that goes from the gut to the brain than from the brain to the gut. So it's so important to have good gut health with the probiotics and the prebiotics. And serotonin is one of the neurochemicals that's responsible for anxiety and depression. So if you have one of those illnesses, a psychiatrist might prescribe for you what's called an SSRI. And so that stands for selective serotonin reuptake inhibitor. And what that does is make sure that there's more bioavailability, more availability of the serotonin in your brain, so it's not reuptake or sucked up back by the cells. And the more that you have, the less anxiety that you're going to have and the less depression that you're going to have. So that's, a natural way to help with your mood is through your diet, through your gut health. Another thing is managing those thoughts, as you mentioned before. So my three-pronged approach, there's a couple different ways that you can address those. I say getting rid of stinking thinking. One is to reframe. Is there a different way to think about this issue? So for example, if you're driving down the freeway and somebody cuts you off, most times, we might think like, oh, what a jerk, that's super inconsiderate, or I've even had people think like, oh, that person's trying to put my life at risk and, all these things. But what if we reframed that? What if we expanded our perspective to, wow, I wonder if that person is maybe having a panic attack and they're trying to hurry up and kind of get off the road as soon as they can. Or maybe they just got news that a family member is in the ER and they're trying to rush and get there. And notice that when you do that, the level of intensity of your emotions might go down from, rage to anger to frustration.
Yeah.
And so it's about, not only the quality or the type of emotion that we're having, but then also the intensity, being able to manage and kind of bring that down. So reframe is one. Another, number two, is redirect. So your thoughts are about, oh my gosh, I'm going to give my daughter lupus, oh, I'm going to die tomorrow, with this pandemic that's happening and all those things. And it can be all consuming, and it can be this like vicious cycle, this circle of, okay, well, what if this happens? It won't be predicting the future and catastrophizing, like worst case scenario. You need to get your mind on something else. So for me, it's watching comedy movies or, talking to my mom. That's why a lot of people will seek out a therapist. Like, okay, well, let me just get this all out and then like put my mind on something else. Some people like do video games, whatever it is, to put your focus and attention on something that is more positive, more meaning making. Like, I love how for you, Kim, you developed this foundation. Let me put my worries, fears, stress, and everything that I went through to serving other people, to helping other people. So that's kind of number two. And then the third one is, I wish I had like a 3 R's, but it's not, it's an A, and it's acceptance. Okay. And acceptance is not kind of like Pollyannish, like, kind of lay down and take it. Like, no, that's not the case. It is, it's almost like, if you watch CNN and there's like that ticker tape at the bottom of the screen, or like you're watching the Weather Channel and like you have the newscasters at the top, and the newscaster's like, oh, in Atlanta, it's going to be a scorcher, and in California, whatever. And then at the bottom, it's like the world news or the world weather. You treat your anxious thoughts or your depressive thoughts like that ticker tape. Okay, it's not something that I can get rid of. It's not something that I can just push all the way out, because maybe I do have a neurochemical imbalance that needs to be, treated by other means, or, whatever the case. So I'll just, accept that they're there, but I'm not going to let that be the biggest screen in my life. My focus is going to be here. My focus is going to be on my family, on, the relationships that bring me joy. My focus is going to be on me, because I'm giving so much of myself. I'm pouring so much into other people's cups that I need to be refilled. So again, this is here. All right, accepting that, but not allowing that to be the main point of your attention.
I love that.
And so one more thing with the redirecting. Okay. Even with that, you might find yourself, I sometimes find myself still kind of circling back to, those unhelpful thoughts, those destructive thoughts, you can do something called thought stopping, which is literally telling yourself, stop, stop. And some people will put like a little rubber band around their wrists, and it's aversive conditioning, and they'll pop themselves every time they tell themselves to stop.
Oh, wow.
So you're training your brain that is not okay.
Yeah.
And like the psychology of it, it actually works.
Nice. So the the 2 R's and the 1A are refrain, redirect, and adapt was the last one?
Accept
was the last one. Okay. So I want to share my friend from Pennsylvania. She shared that she she has anxiety about her daughter getting lupus. And what I want to share with you is that I understand your frustration and anxiety and concern, because I had the exact same, so much so that I was doing really, really silly things and probably getting on my daughter's nerves. But I mean, but it's a valid concern to have, because you have it. How did you get it? And you hope and pray that the people that you love never have to experience something like that. So, it's completely understandable. And I say that if, God forbid, your child or a family member or someone that you love is diagnosed with lupus, look at what they have. They have you. You know what I mean? They have someone that has gone through it, been through it, learning about it. You're on this call today to take steps to better your life with it. So what better option could that person who ends up being diagnosed with lupus have is they have you. So there are a lot of things that are outside of our control, and all we can do is manage the things that we can control. So, if giving your daughter proper diet, gut health, psychological tips that Dr. Blied is sharing with us, if you can do those things to proactively, ensure that she leads the healthiest life that you could possibly give her, I would say just work on the things that you can work on, and the things that are out of your control, they're just, things that you just don't focus on. And someone else shared, is there anything that you would suggest for anxiety that doesn't require a doctor's prescription?
Yes. So a few different things. One, what you put in your body. So taking care of your gut, which we talked about for the last hour. Also exercise. So exercise is actually going to increase the level of dopamine, which is our body's natural happy chemical. It's actually what gets activated and increased when you're taking drugs, or drinking alcohol. And it's just like, okay, those are ways to feel better, but it's not helpful long term. So how can you do that naturally? And the way that you naturally bring on that neurochemical is through physical movement. Now, I understand that some people, because of their pain, may not be able to, run a marathon, for example. That's an extreme example. But it's like, okay, so what can you do? And just getting moving in some way, like my grandma says, like aim beats name, like, anything is better than nothing at all, just a little bit. So maybe you are, marching in your room, or kind of just putting your feet up and down during the commercial breaks. And that's like your routine during every commercial break. Or like you have Netflix, so it's like in between the shows while you're binging or whatever, or something like that. There's also, if you go on YouTube, there are chair yoga. I provide chair yoga, and you can find that on my IG page, other videos. But then there's also chair salsa, chair merengue. Like there's like some really fun things that you can do while you're just seated. So kind of that's one thing, like getting some physical movement in your life. And then also sleep. Yeah. So, and this is kind of a tricky thing, because with depression, for example, you might not sleep enough, or you may sleep too much. So I'm not talking about in like extreme examples, but I'm talking about in the case where your worry is keeping you up at night. that lack of sleep or that poor sleep, not getting to those deeper levels, is going to increase your level of stress. And increased stress is decreased immune function. And so we're talking about ways to try to like manage our stress. So what are some things that you can do to try to bring on, better sleep? So one is, I always recommend to my clients to keep a journal by their bed, because a lot of us, when we're not so busy, we're so busy during the day. And then when we finally have a chance to lay down, that's when our brain starts kind of turning and going like, okay, I need to do this. And what about that? And, and a lot of us manage everything for our household. So if you can keep a journal by your bed and then just write down all those stressors and then say like, okay, like, cognitively you're taking it out of your brain and you're actually putting it onto the paper, and you'd be surprised like how that helps. Like, okay, I don't have to hold on to this during the night because it's already there. You can also make sure that it's called sleep hygiene. Make sure that your environment for sleeping is conducive for sleep. So one thing is you only using the bed for sleep and sex. That's it. So folks who, if you're having problems with sleeping, so, those who like watch TV in the bed and, eat in the bed, like put a chair by your bed, and again, only using your bed for sleep and sex, because we're training our brains to recognize that cue. When I hit the pillow, that is sleep time. Having a cool, comfortable environment, not too hot, not too cold, making sure it's dark, not having any caffeine after 12 p.m. Some people say 2 p.m. I say 12 p.m. She's just like, ooh, that's a hard one.
Okay.
Things like that. And then also not going to bed, not going to bed hungry, but then also not going to bed like overstuffed. You know how sometimes we have the itis? Like our eyes are bigger, like our eyelids are bigger than like our stomachs. We just eat, and then like it feels like the best sleep, right? Like you just like totally knock out. But what's happening is the body is trying to metabolize and digest all that while it's also trying to rest, and that's not conducive to rest. You will sleep, but it won't be those deeper levels of sleep that actually start to heal the body and improve your immune system. So
okay. I like that.
Yeah.
Okay.
Sleep.
So sleep.
Have more sex. That's a stress reliever. That's an immune reliever.
and that can be considered exercise too. But I like how you exercise. And I will tell you that I know firsthand and for a fact that exercise plays such a vital role in our wellness and our anxiety and depression relief, because I've noticed since I have not been able to go to the gym as I used to, since the shutdown of everything, I really feel different. I feel so different and I hate it. So I've been trying to go on walks, but then, I do have issues with ankle and knee problems and things like that. So then that could be another issue. So I'm trying to figure out different ways, but I will say for sure, any sort of exercise that you can get in, even if it's doing yoga, it's considered exercise. If you guys understand how strenuous and hard that yoga can be and how it's holding these positions sometimes and just making these movements, they're really helpful and can also help you relieve some stress and anxiety. And it also gives your mind something else to focus on. So I'm not sure what there's.
In addition to that, like I wanted to just, because we're giving a lot of tips about, get better sleep and manage your thoughts and eat better and all these things. And this can be very hard to actually put into practice. And so I just recommend to everyone who's watching, like, be gentle with yourself and be kind to yourself. And the way to succeed is to build confidence. And the way that you have confidence is by having small successes. So that means you need to break down whatever the task that you're trying to do. If it's like, to cut off dairy or whatever, break it down into small baby steps that you can achieve, that is realistic for you. Experience that success, that'll build your confidence, and then you can move on from there. So just baby steps, and be kind and compassionate to yourself along the way.
I love that. I love that you brought that up, because that sort of brings me and kind of to the conclusion of our live. And, I know that you're going to be announcing a winner as well. But
Yes.
what I had written down for our conclusion of this call is to take it slow, and remember that, as I said, I've had lupus since 2005, and it's only the past 2 to 3 years that I feel like I've lived the best life ever. And it took me a very long time to get there. And the reason why I do this foundation and share what I share is because I don't want it to take that long for you guys. If you were recently diagnosed, or even if you have been diagnosed for lupus for years and multiple years, I hope that what not just I can share, but the people around us in the environment of sharing can give all of us information to help us lead a better life. And us coming together as a community, and us, having sessions like this with people who are professional, like, you and Stephanie, and sharing this information with us is only going to help us. And we can only share, these things. But with you guys having the expertise and actually having lupus, I want everyone on these calls to gravitate towards you guys, because you guys are our inspiration, and this is what, it's going to take. It's going to take these different type of implementations, and it's going to take time. And be patient with yourself, and don't get upset with yourself, and understand that you have to strive for balance. Like I said, I don't think I'll ever go without eating meat. I just love it too much. And if I did, I bet you I would probably have an even healthier life. But for me, that is certain things that I really enjoy and gives me a quality of life, So you have to find out what works for you. I just hope and pray that you guys can do the best that you can to overcome lupus and live the life that you want. So understanding that support is crucial. And even though we're on this lockdown, this is why we're still doing these IG lives, because it's really good to be able to see one another's faces. I know that Jane's going to do a call, and she wants to do a Zoom because she wants to be able to see everyone's face. So it's not just, my big head all the time and whoever our guest is, but we can see everyone and see, support is so crucial, to see your friends, to hug your loved ones, and to get people that understand what you're going through, and remembering health before image, So I was laughing about, my image. I told you by the end of this call, my hair was taking me out. I had to pull it back, but I mean, it's
so great.
Beautiful big head. Thank you, Cindy. But I mean, just remembering, that your health is more important than your image, So it is crucial to. I don't know what happened. Are you still there, Dr. Blied?
I am.
Oh, okay.
Can you hear me?
Yeah, I can hear you, but I think your phone flipped. I don't see you.
Okay. I'm gonna leave and join back, okay?
Okay, sounds good. So, as I was saying, just remembering that, if you're not good on the inside, you're never going to be good on the outside. So, what you're putting inside your body, what you're putting on your body, the things that you're telling yourself, all of that is important. And it's more important than how you look on the outside. The makeup, the hair, the clothes that you wear, nothing is as important as what is on the inside. So spend time perfecting the insides, and let's worry about the outside and what you see in the mirror. And just remembering that everyone's journey is unique, and never, ever compare, because as you with lupus understand more than anyone, each one of us are so different. You see some of us in wheelchairs, you see some of us with canes, you see some of us actually running marathons. I mean, there's so many differences in all of us. So don't ever compare yourself to anyone, and understand that your journey is unique to you, and it can inspire and mean so much to someone else. So we thank you for coming to these lives and joining us and sharing, because it is needed. It is needed to hear other people's stories, because every single one of us has a completely different and unique story. And we all know that with lupus, that each of us react differently to different types of medications, to different types of things, to different types of even, plant-based or healthier options. So all of it is about enjoying the process. All of it is enjoying the process and remembering to constantly invest in your health. It takes time and it takes discipline. And you just take it one day at a time. That's all you can do. You can't be mad at yourself. And one thing that you can always remember is that should you ever feel stuck or at a dead end point, you can always reach out to me. You can always reach out to Dr. Blied. You can always reach out to Stephanie. You can reach out to Mikey. You can reach out to Jane. Any of us with the Lupus House Foundation, we're here for you. And if we don't have the answer, we can direct you to someone that does. So, just enjoy the process. As we said, dancing through the storms of lupus. That's what we're here for. So, with all of that said, Dr. Blied, I would love for you to share anything else that you would love to share. And also, I know a lot of people would like to know if they won the contest. So for the 1 hour coaching session, yeah. Okay, 30 minutes. Coaching. Yeah, 30 minutes.
Like, girl. So let me put this down.
For the last 30 minutes, I was trying to add myself on there.
So, if I had one more thing to add, it's that, and this is something that I'm still working on myself, to take every challenge as an opportunity. So again, it's the reframing your thoughts. Like, okay, yes, I have lupus. I can't be out in the sun. That sucks because I, used to go hiking and those kinds of things. But, now I have the opportunity to, and then fill in the blank. I have the opportunity to see the sunrise because I'm up early before today and before it gets, too hot outside, with the PPC or, what else? There's just, I am a firm believer that all things work together for good. Mm-hmm. Like all things are working together for our good. So, okay, I don't understand this now, but how is this working together for my good? I used to be in choir, and we were singing at, it's a really big deal, at the Disney Concert Hall. And so there was an orchestra, and before the conductor came, they were tuning up, and it sounded horrible. Horrible. It was a cacophony. That's the word for a horrible sound.
Yeah.
And then the conductor came and then it was a symphony. And I was like, wow, I imagine God as a conductor in my life. Mm-hmm. He takes the brass instruments and he takes the horns and he takes the percussion and all this shit, I'm a Christian, of course, too. All this stuff, and it doesn't make sense. And it's like a terrible storm. And then he comes and it all makes sense. It's this beautiful symphony of our life. So if it's not making sense to you right now, I encourage you to wait on your conductor, to wait until you can see behind you, wow, that's why that happened to me. I can speak into this person's life. Wow, that's why I experienced that, heartache, relationship, whatever the case might be.
Yeah, I love that. That's so beautiful. Thank you. Thank you for sharing that. So with that said, do you want to do your contest winner?
Yes. I wanted to qualify that this is a free coaching session. It's not therapy. And there is a difference between therapy and coaching. So coaching it's specific, it's goal focused. We're talking about, improving your health, improving your relationship, something like that. And we're moving forward on that. Versus therapy is more looking at, hey, these are my stressors. I'm trying to figure out how to manage it, dealing with trauma, those kinds of things. Coaching is for when you are already at 80% of your life and you want to get to that next 20 with someone who's going to be an accountability partner and help you set goals and achieve them, versus therapy is maybe you're only at 20, you're trying to get to that 80. Mm-hmm. So like that's the disclaimer.
Thank you.
So our winner, oh, sorry, did you have something?
No, I just said thank you for clarifying that, because, you know, some people may be like, well, what happened to my therapy session? You do
I do.
That, right?
Okay.
I do.
Yeah. For folks who live in either California or Virginia, those are the two states that I'm licensed in. So our winner, who was selected at random from the post, is Candace Girl.
Candace
Girl, spelled with a K, Candace Girl. So I'm not sure if she's still on this live. I will DM her afterward, but Candace Girl has won a free video coaching session. So girl, I hope you're ready. And I look forward to, if any of you guys have questions, I do also provide free 10-minute consultation calls, and you can schedule that on my website, which is www.drblied.com.
Nice. Well, thank you and congratulations to Candace Girl, and hopefully, you guys can set that up and she can share her experience with others so that we know how, how that goes, and other people can set up a session with you as well. So thank you again, Dr. Blied, and thank you so much for all the great information you shared. Thank you for doing that giveaway. And thank you, everyone, for joining. I know that, we do give away a lot, and it's just because we love to give away. We love to have you guys here. And you guys have to remember that when, especially for myself, when I focus and have the opportunity to help others, it's therapeutic for me. I feel like it's almost like I'm being selfish because I'm getting something out of it too, being here for you guys. Dressing up and putting on my purple and doing my hair to come and be on IG Live and laugh and talk with you guys. It does something for my heart and soul as well. So you guys are blessing me with your presence, with your comments, your laughter, your hearts, and all of that. So this is a two-way street, and we'll continue to have these IG Lives. We'll continue to do giveaways and love on you guys from afar until we can be together in person. So thanks again for joining, everyone. Thank you, guys. If you have any questions, you see our information there, or send me a DM and I can direct you. So thanks again, everybody.
Bye.
Bye.